Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the anterior mediastinum. We know the mediastinum are group of structure between the lungs. Suppose this is the right lung, and this is the left lung. The structures in between them, this shaded area, this is the mediastinum. Okay, these are the structures, those belongs to the mediastinum. So mediastinums are group of structure which are present in between the lungs are not part of the mediastinum. These structures are the mediastinum. Okay. Then for the convenience of our study, we divide the mediastinum into superior mediastinum and inferior mediastinum. Superior mediastinum and inferior mediastinum are described in relationship to that of the transverse thoracic plane. So this is the transverse thoracic plane, transverse thoracic plane that passes between the sternal angle anteriorly. Here is the sternal angle anteriorly, and the intervertebral disc between T4 T5 is the transverse thoracic plane. So the structures above the transverse thoracic plane are the structures of superior mediastinum. So these structures above the transverse thoracic plane, these are the content of superior mediastinum. So all the structures of the mediastinum which are below the transverse thoracic plane are the content of inferior mediastinum. So everything below the transverse thoracic plane, this is the transverse, this plane is the transverse thoracic plane. Okay, so all the structure below the transverse thoracic plane are the content of inferior mediastinum. Inferior mediastinum again divided into three parts. One is the anterior mediastinum, then we have the middle mediastinum, and we have the posterior mediastinum. Okay, so you got this is anterior mediastinum number 1, this is the middle mediastinum number 2, this is the posterior mediastinum number 3. All the structures here are the structures of anterior mediastinum. All the structures here are the structures of middle mediastinum. All the structures here are the structures of posterior mediastinum. Today I will discuss about anterior mediastinum. Okay. So what is the boundary? What are the boundaries of the anterior mediastinum? Okay. Boundaries of the anterior mediastinum. Okay. Boundaries of the anterior mediastinum. So anteriorly we have the body of the sternum. This is the body of the sternum, also called mesosternum. Body of the sternum. Posteriorly, the fibrous pericardium. This is the boundary. The fibrous pericardium. On each side, mediastinal pleura. Below, it is bounded by the diaphragm, the diaphragm. Above, it is bounded by the transverse thoracic plane. Transverse thoracic plane. Okay, we got the boundaries of the anterior mediastinum. Anteriorly, body of the sternum. Posteriorly, fibrous pericardium containing the heart. Fibrous pericardium. On each side, mediastinal pleura. Below, the diaphragm. This is the diaphragm. Okay, below the diaphragm, above by the transverse thoracic plane. So this is limited below by the transverse, below by the diaphragm. Above, this is an imaginary plane. This is not a structure. This is the transverse thoracic plane that goes from the sternal angle anteriorly to the intervertebral disc between T4 T5. So this is transverse thoracic plane. So above, it is continuous with the pretracheal region of the superior mediastinum. So the anterior mediastinum is continuous above with the pretracheal space of the superior mediastinum. You may write here the anterior mediastinum is continuous with the pretracheal space of the superior mediastinum. Okay, we got that. We got the boundary. Now we'll go to the contents. Contents. We have content are the sternopericardial ligament. Sternopericardial ligament that connects the sternal body to the fibrous pericardium. Sternal body here to the fibrous pericardium. Then we'll get the mediastinal branches of the internal thoracic artery. Internal thoracic artery. Okay, we'll get lymph nodes and lymphatics. Okay, we got the sternopericardial ligament, lymph nodes with lymphatics, mediastinal branches of the internal thoracic artery, and certainly the lowest part of the thymus, especially in children and adolescents. Lowest part of thymus in children and adolescent. Okay, we may get the lowest part of the thymus that may go to the up to the level of fourth costal cartilage level. We'll get areolar tissue and fat. Okay, so we got the contents of the anterior mediastinum. Now we'll learn some clinical anatomy. Clinical anatomy will give emphasis on the DeGeorge syndrome. DeGeorge syndrome. Okay, in that syndrome, the thymus may not develop. Thymus may be absent or very small may cause decrease in and causes small and causes decrease in cell mediated immunity. Plus, we may have atrophic parathyroid. There may be some problem in the thyroid also in DeGeorge syndrome. This is a clinical syndrome. Okay, that may happen due to lack of development of the thymus. Okay, we got that. And also one more important point is that the thymus gland may develop hypertrophy or tumor. Okay, the thymus gland may be hypertrophied or neoplastic called thymoma that may cause myasthenia gravis. Myasthenia gravis. Okay, we got the clinical importance. One is DeGeorge syndrome, lack of thymus. Another is the hypertrophy of the thymus or the thymoma of the thymus that may lead to myasthenia gravis. Management is to remove the tumor, thymectomy. That may work. Okay, that's all about the boundary and contents of the anterior mediastinum and its clinical importance. If you like my video, please support my channel. Please subscribe me. Share the information with your friends and have a nice day. Bye now.